Hello and welcome to Clover Cure, and to this important video where we'll be exploring 5 warning signs of cancer that are often overlooked. Before we begin, I want to be clear that I am not a medical professional. This video is meant for informational purposes only, to emphasize that early detection can make a tremendous difference. No video or article can replace professional guidance. Let's start with the most common signs. Number 1. Unexplained, persistent fatigue. Are you experiencing a type of tiredness that doesn't go away with rest? Feeling tired is something we've all experienced, especially if our schedules are hectic, our stress levels are high, or we don't get enough quality sleep. However, the kind of fatigue that may point to an underlying health concern is different in its intensity and duration. It's the type that lingers for weeks or even months, and it may not have a clear-cut cause such as a new job, recent travel, or poor sleeping habits. Cancer-related fatigue often comes on gradually and intensifies over time, but it can also appear quite suddenly. Many people describe it as being so exhausted that normal daily activities, like climbing a flight of stairs, going grocery shopping, or focusing on routine tasks, become overwhelmingly challenging. Why does cancer cause fatigue? One reason is that certain types of cancer cells consume more of the body's energy resources. Additionally, the body may be mounting an immune response, creating inflammation that leads to feelings of weakness and exhaustion. If you find yourself constantly out of breath, unable to concentrate, or needing excessive amounts of rest compared to your usual baseline, this may be a sign to pay attention to. Number 2. Changes in skin or moles. This can include alterations in the size, shape, or color of moles, as well as non-healing sores or unusual growths. When it comes to skin cancer, particularly melanoma, early detection can be life-saving. The most common guideline for monitoring moles and other skin spots is the ABCDE rule. A for asymmetry, one half of a mole or birthmark doesn't match the other. B for border, edges are irregular, ragged, notched, or blurred. C for color, color is not uniform and may include shades of brown or black, sometimes with patches of pink, red, white, or blue. D for diameter, the spot is larger than 6 millimeters across, about the size of a pencil eraser, although some melanomas can be smaller. E for evolving, the mole changes in size, shape, or color, or begins to itch, bleed, or scab. Beyond moles, keep an eye out for skin sores that don't heal or repeatedly form a scab and break open. While this might simply be a stubborn sore or a result of minor trauma, non-healing or frequently recurring sores could be a red flag for skin cancer or other conditions. Additionally, patches of skin that become unusually dry, scaly, or red could warrant a checkup. Number 3. Unusual bleeding or discharge, which can come from areas of the body that don't ordinarily bleed or occur at times that seem abnormal. This sign can take various forms, depending on the part of the body affected. Coughing up blood might indicate lung issues, including lung cancer, especially if accompanied by persistent cough or changes in voice. Blood in the stool can sometimes appear bright red or as darker, tarry stools. While it can be caused by hemorrhoids or ulcers, it can also be associated with colorectal cancer. Any sign of blood in your stool that doesn't have a clear explanation should be evaluated by a healthcare provider. Blood in the urine could be a sign of a urinary tract infection or kidney stones, but it can also suggest bladder or kidney cancer. Unusual vaginal bleeding, such as bleeding between menstrual periods, after sexual intercourse, or after menopause, may indicate cervical, uterine, or other gynecological cancers. Nipple discharge, particularly if it's bloody or happens spontaneously, could be a warning sign for breast cancer. Spotting blood where it doesn't belong or experiencing abnormal discharge is a significant signal. It's always better to rule out serious conditions early rather than wait until symptoms worsen. A physician can conduct the proper tests, blood work, imaging, endoscopy, or biopsies to find out if the underlying cause is cancer-related or a treatable benign condition. Number 4. Persistent pain or discomfort. It might seem obvious that persistent pain could be a sign of something serious, yet many individuals live with ongoing discomfort without seeking medical attention. Sometimes we adopt the mentality that aches and pains are just part of life or part of getting older. While it's true that certain chronic pains might be related to non-cancer conditions, like arthritis or old injuries, unexplained, persistent pain can signal a deeper issue. Cancer pain can be tricky because it doesn't always manifest in the same way for everyone. For instance, a dull ache in your bones or joints might point to bone cancer or leukemia, while chronic headaches that become progressively more severe could, in rare cases, be related to a brain tumor. Pain in the abdomen or pelvis could be linked to cancers of the digestive or reproductive systems. Sometimes pain indirectly results from a tumor pressing on nerves, bones, or organs. Other times, the pain could be a result of changes that cancer cells trigger in the body's chemistry. The key here is unexplained consistency. If you experience a type of pain that either intensifies over time or simply won't go away, it's a signal to get it checked out. Pain management medications might temporarily mask discomfort, but they don't address the underlying cause. Number 5. Long-lasting cough or hoarseness. A cough that just won't go away can be symptomatic of many respiratory conditions, such as a lingering infection, allergies, or asthma. However, when a cough persists for more than a few weeks, especially if it's accompanied by changes in phlegm or by shortness of breath, it becomes a potential warning sign, particularly for lung cancer or throat cancer. Hoarseness or significant changes in your voice might indicate issues with your vocal cords or surrounding tissues. It could be something as simple as overuse, like from yelling or singing, acid reflux, or an infection. But if hoarseness lingers for more than 2 weeks, especially without an obvious cause, it deserves attention. Some throat and thyroid cancers can present with voice changes, and persistent hoarseness may signal that a tumor is pressing on nerves associated with the vocal cords. Beyond the duration of the cough or hoarseness, pay attention to accompanying symptoms. Shortness of breath. Do you find it more difficult to breathe than usual, even during mild activity? Chest pain. Is there a dull or sharp pain in your chest when coughing or breathing deeply? Unintentional weight loss. Are you losing weight without changing your diet or exercise habits? Coughing up blood. This symptom always warrants immediate medical attention. If you notice these red flags alongside a chronic cough, make an appointment with your healthcare provider. Diagnostic tests like chest x-rays or CT scans can help identify potential tumors or other lung abnormalities early on. Early detection of cancer is crucial. Many types of cancer, when caught in the initial stages, have higher survival rates and can be treated more effectively. By the time more severe symptoms manifest, the cancer may have already progressed, making treatment more complicated. While not all cancers can be prevented, there are proactive steps you can take to reduce your overall risk and improve your chances of early detection. 1. Regular checkups. Schedule routine health exams, even if you feel well. Healthcare providers can catch subtle changes that might not be obvious to you. 2. Healthy lifestyle choices. Maintain a balanced diet full of fruits, vegetables, whole grains, and lean proteins. Exercise regularly according to your ability level, keep hydrated, and aim for quality sleep each night. 3. Avoid or limit carcinogens. Steer clear of tobacco in all forms, minimize alcohol consumption, protect your skin from excessive UV exposure, and be mindful of environmental or occupational hazards. 4. Know your family history. Some cancers have a genetic component. If cancer runs in your family, you may need more frequent screenings or genetic counseling. 5. Listen to your body. Pay attention to changes or persistent symptoms, and if something feels off, don't wait. Get it checked. Remember to take good care of yourself and stay attuned to the signals your body sends. You deserve the best possible care and attention, and that starts with being informed and acting on any concerning changes. If you found this content helpful, consider sharing it with friends or family who might benefit from learning about these often overlooked warning signs. Together, we can spread awareness and encourage those we care about to stay proactive about their well-being. Thank you again for joining us, and until next time, stay vigilant, stay healthy, and remember, early detection can make all the difference.